Why is lupus so hard to diagnose? Imagine trying to solve a puzzle where the pieces keep changing shape and size. That's what doctors face when trying to diagnose lupus. It's a tricky disease that can hide behind many different symptoms. Lupus, especially systemic lupus erythematosus, is an autoimmune disease. That means the body's immune system mistakenly attacks its own tissues. But the symptoms can involve almost any part of the body, like the skin, joints, kidneys, or blood. Because of this, no two people with lupus look exactly the same. One big challenge is that the symptoms are very broad. Some people have rashes or joint pain, while others might have kidney issues or fatigue. These signs can also be caused by many other illnesses, so it makes it hard to tell what's really going on. Doctors often look for specific blood tests called antinuclear antibodies. But these antibodies are not unique to lupus. They can appear in healthy people or those with other conditions. So, a positive test doesn't confirm lupus on its own. Instead, doctors need to piece together many clues from symptoms, blood tests, and physical exams. Lupus also has a pattern of flares and remission. That means symptoms can come and go, sometimes suddenly. Early signs are often mild or nonspecific, so they can be overlooked or mistaken for something else. This can delay diagnosis for months or even years. Another issue is that lupus symptoms overlap with other autoimmune diseases like rheumatoid arthritis or psoriasis. Because of this, doctors must carefully rule out other conditions before confirming lupus. Since lupus is relatively rare and its symptoms are so varied, primary care doctors and specialists might not think of it right away. This can lead to multiple misdiagnoses and delays in seeing a rheumatologist, a doctor who specializes in joint and autoimmune diseases. Different populations may experience lupus differently. Some groups tend to have more severe or unusual symptoms, which can either speed up or slow down diagnosis depending on how aware doctors are of these differences. From a rheumatologist's point of view, diagnosing lupus involves a detailed patient history and a thorough physical exam. They use specific classification criteria that combine clinical signs with lab results. Early diagnosis is important to prevent organ damage, but it remains difficult because of the disease's complexity. To improve diagnosis, doctors are increasingly using new biomarkers or blood markers that might be more specific to lupus. Better collaboration between primary care providers and specialists also helps catch the disease sooner. Monitoring patients over time is key, especially if they have some symptoms but don't meet all the criteria for lupus yet. This way, doctors can watch for changes that might indicate the disease is developing fully. In short, lupus is hard to diagnose because it affects many parts of the body, has symptoms that overlap with other conditions, and lacks a single test that can confirm it. It requires careful, ongoing evaluation by experienced doctors, especially rheumatologists, to identify it as early as possible and start treatment.